All right. This is Dr. Mahajan from Mahajan Medical Center. Very excited to be back with you guys today. Um, as you know, I'm an internist in Largo, Florida, and we do a weekly broadcast where I share my insight into COVID 19 and any other urgent emergent topics where I can provide my input. We do that. Today, we're going to be talking about the phase one, the opening up of the different places in all over the world, post lockdown, how safe they are. So, we're going to start with looking at, we'll break it down into different pieces, um, which include flying, going to restaurants, whether you can visit your loved one in nursing home. We have someone asked that question yesterday. Um, can we go to the dentist? Can we go to the doctors? How safe is that? If you have to go, what precautions you should take. So we're going to cover all those topics today. So I want you to think in any of those activities about four dimensions, not just 6 feet, which is just a distance, but also thinks about time, activity, and environment. So, time, what do you mean by time, or what I mean by time? So, let's say you go visit a friend, you've not seen a friend, and you want to visit her or him. Now, they are not in your bubble, so that's a risk for you. So, the time factor is how much time did you spend with your friend? So, that's time. And then the activity. So, are you meeting indoor in the friend's house? So, that will increase your risk of getting COVID 19. If you go for a walk with your friend and both wearing a mask, now this activity is relatively safer, not 100% safe. As long as you maintain 6 feet distance and wearing a mask, you reduce the risk. So, that's time and activity. And the environment. So again, the environment is outdoor versus indoors versus more intimate space. So that's how you need to be thinking about any of your activities if you're going to be doing. So let's take a step further. Um, and if you're listening and we have a few listeners tune in, please do send me your love and your vows and likes. So I know that you're hearing it well and you're appreciating our broadcast, which we put a lot of effort every week into. So do send us those now and keep sending it to us while we are doing it. Do share our broadcast with your friends and family so that they can also have access to good science-based information in this COVID-19 era. So let's talk about restaurant. I know a lot of you folks are itching to go to your favorite watering hole and get a drink or two or eat your favorite meals. How safe are those? So again, look through those four dimensions, which is distance, time, activity, and environment. So let's break it down. So the restaurant, again, the environment. If it's outdoors, that's a little bit less risk than indoor environment. Outdoor environment, the droplets can spread out, and then also the sun and the humidity plays a part in disintegrating the virus. So outdoor sitting is much better. One thing I'll recommend to all my patients who are eager to start eating out is to make sure they're wearing a mask. Now you would say, how are you going to eat or drink with a mask on? And that's going to be a challenge. So you should leave the mask on if you're ordering. And once you get your food or drinks, then of course you have to take your mask off. But if you start talking to your friend or to the server, you should, as a courtesy, put the mask back on. Because anytime you talk, sing, laugh, the droplets going out from your mouth and nose goes up. Same thing with the server. So, before you sit down, check the restaurant. If they have not taken any precautions which are different, there's a lot of crowd, maybe it's not a time to go in that restaurant. If the servers are wearing masks and they're making sure there is enough distance between the tables, and they're cleaning the space regularly, then that's a good place with a little bit less chance of spreading the COVID at the time when you're eating. What about indoor spaces in a restaurant? Indoor spaces in a restaurant will be very tricky. If you have comorbid conditions, diabetes, obesity, or you're older adult, more than 65, that's not safe. Again, if it's a big restaurant and they have capability of moving the booths, which is, as you know, booths are fixed in and they're going to be hard to move, then it's a little bit safer than if they can't move the booths. So you got to look at every place in those 4 dimensions I talked to you about, which is again in repetition, the distance, the environment, the time, and activity. Now, how about paying? If you pay cashless. As I alluded to earlier, broadcast currency exchange could increase your risk of contacting someone else COVID-19 transmission. So if you can use a credit card or even cashless with Apple Pay, that's better. Last not the least, about the menus. If you're touching the laminate menu again and again, and someone else touched it and they are not wiping them clean in between, then there's one object which has been touched quite a bit by the servers and by the patrons. So maybe you just glance it while on the table, don't handle it too much, or take your own wipes and wipe the laminated menu before you touch it. Or the best option is if there is a chalkboard of the menu, you can read through that before you enter, and that way you're not touching anything. One important aspect is that a lot of people are not wearing masks, and you need to think about the servers. The servers are at much higher risk than the patrons in a restaurant. So be kind to the servers. Otherwise, you will increase their risk if you're an asymptomatic carrier. And most of the time, you're unwinding in a restaurant, so you're talking, you're laughing, and that's when you're throwing the droplets more. So think about the servers too. They're getting it all day long, and you don't want to do that. If you can wear the mask when you're ordering, be kind to them. And also, last not the least, tip them well. They had a horrendous 2-3 months where they didn't have a whole lot of work. So I think it's a good idea to tip them well. Lily is with us, and Lily always supports our podcast and broadcast. So thank you, Lily, for continuous support and your input, and you send your daughter as a referral, so that will help us keep our lights on. So we are taking new patients, so keep sending us your friends and family. Mark had a comment, so let's bring that up. Mark is saying you can look at the menu only on internet. So that's a great point, Mark. And Mark is a great, thoughtful guy, and he always had great questions. So I appreciate your support and your input and insights, Mark. So yes, so you can, before you leave, I think that's a very good point Mark brings. You should definitely check the social media, like a Google website of the restaurant and their Facebook page to see what post COVID-19 phase one policies they have implemented. Are they checking their servers for infections? Some are, which is a great thing if they are. Are they cleaning more frequently? What have they put on their social media sites? And also, as Mark pointed out, that you can look at the menu online too. So that's a great thought, Mark. Thank you for sharing. Let's talk about flying and the airports. I know a lot of patients are asking me that question now. The summer is over here in Florida. I'm sorry, summer started in Florida, and they're getting itchy to get out of the heat from here. And a lot of folks who comes during winters here, they're asking, is it safe to fly? So my answer to that is, it's never safe to fly if you have comorbid conditions. But is it safe to drive 20 hours? The answer is, 20 hours is a lot of driving, and then you have to stop at the restrooms and the restaurants and the hotels. So what's worse, flying or 20 hours of driving? So you have to make your individual decisions on that. But in flying, if you have to think about the good things, the flying, they use HEPA filters in the aeroplanes. So that does take away most of the microbes. But you can't prevent someone sitting next to you or in next row coughing, and if they are a carrier. So I think the risk is much more as the spaces are more intimate, and the airlines have to make money. So I don't think they're going to fly with the middle seat blocked all the time. As they get more busier, I don't think the middle seat being blocked will be in effect. So that's what makes the airline travel a little bit more trickier, because the co-passengers, and then you're standing in line for security, for when you're waiting for the get on the plane. So there are a lot of bottlenecks where you're going to be in contact with a lot of people. So it's tricky. So what can you do? So let's talk about starting your ride from home. Uber and Lyft, they want you to wear masks. So be prepared if you're going to go through Uber and Lyft, and they stop the share ride. So you're going to pay a little bit more, because you can't share rides with other people, which is understandable, and you don't want to be sharing ride with strangers when you don't know their health status. So that's number one. Number two, maybe get a ride if you can from a loved one who is in your bubble and you are familiar with their health status if you're going to the airport. The other thing you can do is use all the apps. So the airline industry has provided apps to check in. In fact, they're adding more things like luggage and all that to the apps now, so that people are not touching a whole lot of things. So get familiar with their apps, download it before your journey, and get your boarding pass on the app, and do as much as you can on the app. So that way, by the time you're at the airport, you not have a boarding pass to handle paper boarding pass, which you have to give to a lot of people. So in fact, if you have on the app, then you can just show it. Now, you should always carry a sanitizer with you, and try to get a window seat. I know it's hard sometimes, but if you have option of pre-assigned seating, window seat, if you're not using the bathroom as much, you're not going in and out of the other two people. So that's a little bit less contact. The other thing, there was a virologist we covered in the previous podcast who got the COVID-19, he thinks, from his eyes, and he had his N95 mask while he was flying. So, if you're going to be in a tight space and the plane is full, make sure you're wearing a eye protection too. So that's a important pointer in addition to the mask. Um, the airlines is encouraging you to eat before you come, and if it's a domestic flight, some of them are not allowing you to eat. So maybe take your food with you and eat before you board the plane. Some airlines are allowing it, but I'd probably take my own food, because then you're not giving your money or credit card to them and taking it in another transaction. So you got to start planning ahead, less transaction, less touching. Maybe use Apple Pay. A lot of airports recently have changed policy. They're not taking currency. They're using credit card or Apple Pay. So maybe look into Apple Pay if you are has a Apple iPhone, or in terms of so we talked about wearing glasses on the plane, using sanitizers frequently. The airlines industry is putting a lot of work into cleaning their planes in between. They're spending more into energy into that, so that will be helpful. And then wearing a mask. So those are simple tricks, and try to get a window seat and take your food with you. And then hopefully, no one sitting next to you. That's your luck. I was looking at a article yesterday. I think the airlines are looking at post-COVID-19 scenario, and they're adding dividers in between the 3-seat setup, so that way, if the pandemic continue, then they can use the divider in between the seats. So that's something down the line. So that's will come if this stays the way it is, because they have to fill their seats. So that's about the flying. In terms of hotels, if you are traveling by car, public restrooms and hotels, let's talk about that. There is some studies showing that the COVID-19 does come in your feces. So, and plus the public restrooms have a lot of contact from a lot of people. So definitely use hand sanitizers, keep it handy on your trips, and wipes. So that way you can wipe the area around the knobs which you're touching before you touch. And standard precaution, hygiene precaution you use while using the toilet, keep on an extra guard. So, you got to use more precautions. How about public transport? Let's say you have to go to doctor's office or dentist's office, or, some other place, or grocery store. How safe are the buses? So let's get you, there's some beautiful studies out of China in terms of tracing. They have done contact tracing. So there was the example I was reading. There were 2 buses. They were going to a temple, and one bus unfortunately had a asymptomatic carrier, and he or she didn't know that he or she had COVID-19. So the both buses went to the temple, and then other people came with their own vehicles or different vehicles. So there were other people's too, which mingled with the crowd from these 2 buses. So then they did the tracing on both buses and all other people in the temple. And what they found is that, which is very interesting, the bus, the passengers which were traveling with the asymptomatic carrier had about 30% transmission. So out of 100, out of 30 passengers got COVID-19. The other bus had none. So, again, it comes to the 4 dimensions I talked about earlier in terms of the activity, environment, and distance. So the bus does not have HEPA filter. Some buses do, but luxury buses do, but a lot of buses don't. So then you're talking, you're singing maybe, or definitely talking, and sneezing, coughing. So and it's a tight, small environment. So that can apply to any public transport. Could be subway, it could be any other public transport. So I think public transport, you have higher risk because of being in proximity and the time. So let's talk about time. So the average time in the lab indoors, after chatting, singing or laughing, the droplets can stay up in the air for about 14-15 minutes. So the 15 minutes is what the scientists say. If you're spending more than 15 minutes in a close proximity, whether indoor spaces with your friend's house or church or uh, bus, your chance of getting COVID-19 goes much higher. But that doesn't mean if it's 14 minutes you won't get it. It's just a concept that longer time you spend with asymptomatic carrier, more talking and singing and laughing is involved, more chances of you getting it. So I think the other example I gave in my previous broadcast applies here as well, is the choir singing, in the church in Washington State, and they were in the church for 2.5 hours. They were older folks, and they were singing, and they were in a smaller group practicing singing and had food together. And I think about 15-20% of the group got the COVID-19 from one asymptomatic singer, who didn't know that he or she had COVID-19. So that's indoor spaces, poorly ventilated spaces is high risk. Now, the poor ventilation brings me to the next point, which is if you're in a hotel and you're in a friend's house, if you have an option, open the window. Opening the window gets the fresh air from outside to inside, and the stale air from inside goes out. So good ventilation is critical in a hotel or indoor space. So if you go to a restaurant, for example, and they have the windows closed, so ask them to open the windows. So that's will help to dilute the air and get some circulation going inside the indoor spaces. So that take care of the buses. What about grocery store? We dealt with that in the past. I think it's a bigger space. The risk is more for grocery store clerks or the grocery store employees than for someone going in with a mask and the grocery store clerks wearing a mask, and you're not spending a whole lot of time. So Jenny said that she started this on my page. Thank you, Jenny, and we appreciate our patients and acquaintances sharing our page with their friends and family, because we put a lot of work into making this broadcast information full. So appreciate your help, Jenny. All right, so we were talking about hotels, and if you can open the window there, that'll be helpful. Also, talking about hotels, try avoiding, going with other people in the elevators. Let them go and use a different elevator. If you have option, if the room has not been used for a couple of days, ask them. I know whether once it get busy, if you have that option, but since it's not that busy, typically, the virus will die out in a couple of days in most of the surfaces. So if the room has not been used for more than 2 days, your chances of getting it through contact is less. If the hotel is very busy, and if you're just traveling and you've not made reservations, maybe go to a different hotel, go to a less busy hotel, because then the restaurants will be busy and the lobbies will be busy and the elevators will be busy. So you want to stay away, if possible, from a busy hotel. So we talked about restaurants, we talked about hotels, we talked about flying, we talked about meeting with friends. Let's talk about salons. So I know, I had my haircut done. So let me share my experience and what I did, and what you should do too. So I had the advantage that I had an N95 mask, but if you don't have that, just make sure you have a good mask with a filter, and we covered that topic: how to add a filter to a mask, with a cloth mask. So do wear a mask with a filter if you're going to a salon, because that's in you can't go 6 feet. They don't have 6 feet scissors. They have to be close to you, and then you're chatting with your favorite hairdresser. So there's a lot of laughter, there's a lot of talking and yapping. So that's not a good environment, as you probably heard. I think Great Clips had in one of the states, I forgot, 2 3 weeks ago, two asymptomatic, stylists who gave it to a lot of patrons. So make sure they're wearing a mask. Interesting that the one where I went, they were very good with that. They didn't have a whole lot of patrons there, so I think I was the only one. But it may change as it gets busier. So maybe go in timings when it's off peak. Ask them, if they're busy right now, then maybe not go. Number one. Number two, again, go to their Facebook page or their website. See what precautions are they taking. Are they wiping their chairs down? Are they doing testing on their stylists regularly? Because that's a very tight space and tight encounter. So you got to take extra precautions. So otherwise, if you have a loved one who is 80-year-old, and let the hair grow, it's just, it is what it is, or you need to take precautions. If you can find a good mask with HEPA filter, make sure you're wearing that. And try not chatting too much, engaging in big conversation. Try getting, smaller work done, like clipping, and not doing coloring maybe. So that way you, again, think about 4 dimensions we talked about earlier, which is, again, activity, time, environment, and distance. So distance is very hard in salons. Same thing applies to dentists. If you think about it, dentist and salon is similar experience. The only thing different is in dentists, you can't wear a mask. So that's even more difficult environment not to inhale. So the good thing is the dentist most likely, will be more regulated environment because it's a medical office, and they should have better cleaning strategies, and it's not as crowded, but it's a tighter space. So if you can postpone your cleaning for a few more months, unless it's a emergency, you have a dental infection and you got to do what you got to do, then you got to do it. But again, make sure there's not many people in the lobby. Make sure the dentist is wearing a N95 mask. Make sure you're wearing a mask at least while you're sitting in the lobby and while you're waiting for the dentist to come. And then wash your hands. Don't touch your face. The standard precautions, but it's much more riskier. So if you can postpone the cleaning or the electives with the dentist, I will recommend that, especially if you have comorbid conditions, because I don't see how you can really reduce your risk with your mouth open and doing procedures in a close quarters. So we covered the dentist, we covered salons, we covered airports, we covered buses, we covered car rides, hotels. So those are the common ones. Mark asked me yesterday, and as I said, Mark asked good questions about visiting a loved one in nursing home or assisted living. When is that going to happen? And I answered that in my yesterday teaser. I don't think it's safe, unfortunately, for the loved ones who are in these facilities, because they are the sicker ones. They are the one with age not in favor of them, and they have multiple comorbid conditions. So, though I know I go to nursing homes, I go to assisted livings, I feel their loneliness, but I think I'd rather have my loved one lonely than have COVID-19 and be on ventilator. So I don't think that population, unless we get a vaccine or get herd immunity, 70% plus in the throughout the community, will be a safe place for visitors. on a compassionate basis, God forbid your loved one is not doing well, and you wear the full gear, the N95, the shield, and or get yourself tested on that day and then go next day, So with those precautions, yes, on a case-to-case basis, you can work with the administrator, and if they are not doing well, then you don't want them have them to die, by themselves. So absolutely, you got to do what you got to do. But otherwise, to answer Mark's question, visitation in nursing home and ALF going to be way down the line once we have some herd immunity in the community. Also, another important point I forgot to mention earlier with any of those scenarios, with phase one opening up in different businesses we talked about, is look at the data on that particular county or the city we are visiting in terms of in their health department, how many new cases has happened in the last few days. And there's beautiful graphs the health departments are putting out in every county, including our county, in Pinellas County. They're doing a great job putting the data in a simple manner, in a graphical manner. And if you see a lot of cases happening in that community, maybe it's not the time to go. Maybe wait for the curve to flatten out. Sometime a couple of weeks, you will see the curve flattening out and the number of new cases going down. That may be the time to get a haircut or see a dentist or whatever else you have in mind for public places. So that's my 2 cents for the phase one opening up. We got Cindy here. She's saying, thank you, Dr. Mahajan, for great information. Thank you, Cindy. Cindy is a good patient of ours and good supporter of our podcast. So we appreciate Cindy helping us to spread the message. Thank you, Cindy. So, I know we talked a little bit yesterday about this, the social unrest we have in the country. And I think, and everyone is have some thoughts about that. And I think whatever happened is unfortunate and sad. And we need to, do some introspection and share the pain of the injustice to his family and the community over the last decade. So with the solidarity, I want to observe a moment of silence. So please do that with me, and then we'll move on to the victory breath or Ujjayi breaths, and which will help you with the time of anxiety. I think COVID-19 didn't help the cause with so much frustration, unemployment, and financial losses to small businesses and young kids home from schools and colleges, and a lot of restless energy. But this is more a systemic, institutionalized issue, and I'm glad the youth is participating in, and hopefully they do it peacefully. So with that, let's observe a moment of silence to honor, anyone who's suffering and have pain for right now or in the past. Thank you for doing that and showing your solidarity with people who are suffering. Let's talk about the victory breath. I try to incorporate a breathing technique every time in my podcast. As I explained to you multiple times, that I feel that breathing is a great tool which is under our control. And if you look at the physiology behind breathing is beautiful. We breathe 25,000 times a day, and if we can spend a little bit of time in training our body to breathe better, I think we can control a lot of our ailments. A lot of our mental health will improve too. And there's no side effects from doing the breathing exercises. So today we're going to do a breathing exercise which is called victory breath or Ujjayi breath. So it's not hard. It's just a matter of practice, and you will see the benefit if you practice either of those breathing or all of those breathing, which I taught in last couple of months to you guys. So the victory breath is more a breathing which is very simple and is sound based. So it's like, you're breathing in and you're breathing out and you're creating a ha sound and you're breathing out and you're fogging the mirror when you exhalation. So just watch me. So breathe in with me and then go like you're fogging the mirror. So breathe in one more time. So this time we're going to do a little bit different. So the nose is your best place to breathe in and out if you can. Some people have, deviated nasal septum, so they have a hard time, or they have nasal congestion with allergies, so it's hard. But nose is fantastic because it has cilia, which are the fine hair, and it also regulates the temperature of the air going in. So, it picks up all the viruses, immune debris, and it's a fantastic filter. So the second part we're going to do in the victory breath is we're going to close our lips, same concept, but now we're going to breathe out through our closed lips through our nose. So it will be like this. So it's like a Darth Vader breathing. It's like hissing breathing. So the breath is circulating up here when you're breathing in, and when you're breathing out, it's a little bit constricted up here. So that's what creates the sound. So watch me again and do it with me. One more time. Wasn't hard. You practice it more, maybe 10 times, twice a day. You will see the difference in 3 months. You'll be calmer, you'll be more relaxed, you'll have more air capacity if you suffer from COPD or any heart failure. It will expand your lungs. Always do them sitting up. Make sure the spine is erect and you're trying to smile and your jaw is relaxed anytime you're doing breathing. With that, we come to the end of our podcast. I appreciate you guys listening to me and doing the moment of silence with me, practicing the breathing with me. We'll meet with you. Hope to see you all again on next Thursday at 4:30. And do check us on YouTube and Periscope in addition to the Facebook. So we are there, and give us a like. So thank you. And appreciate you doing the social distancing. With that, I want to say be nice to yourself, be nice to your fellow friends and human being, and be nice to the biosphere. Ciao.